By the way, before this law, before Obamacare, health insurance rates for everybody, whether you got your insurance on the job or you were buying it on your own, health insurance rates generally were going up really fast. This law has actually slowed down the pace of healthcare inflation. So every year premiums have gone up, but they've gone up the slowest in 50 years since Obamacare was passed. In fact, if your family gets insurance through your job, your family is paying on average about $3,600 less per year than you would be if the cost trends that had existed before the law were passed had continued. Think about that. That's money in your pocket. Now, some people may say, well, I've seen my copays go up, or my networks have changed. But these are decisions that are made by your employers. It's not because of Obamacare. They're not determined by the Affordable Care Act. So, if the Affordable Care Act, if Obamacare hasn't changed the coverage of the 80% of Americans who already had insurance, except to make it a better value, except to make it more reliable, how has the law impacted the other 15 or 20% of Americans who didn't have health insurance through their job, or didn't qualify for Medicaid, or didn't qualify for Medicare? Well, before the Affordable Care Act, frankly, you were probably out of luck. Either you had to buy health insurance on your own because you weren't getting it through the job, and it was wildly expensive, and your premiums were going up all the time, and if you happened to get sick and use the insurer the next year could drop you, and if you had had an illness like cancer or diabetes or some other chronic disease, you couldn't buy a new insurance because the insurance company's attitude was, you know what, this is just going to cost us money. We don't want to insure you. So if you were trying to buy health insurance on your own, it was either hugely expensive or didn't provide very effective coverage.